give away the $500 before the end of the show, right before the end of the show, but I heard from this guy that you should just keep listening because they could change it up on Friday and pop in at any moment. We could be interviewing Jon Fernandez and be like, hold on, John. Okay, call now. Win $500. So just stand by, guys, and stay ready. And, hey, speak of the superintendent, Guam Department of Education Superintendent Jon Fernandez joins us now. John, I'm sure you've seen the comments. The executive order came out yesterday. So did some very alarming data from public health. And I know you're good at reading the room, and people just really feeling we're pretty bad with the COVID. And so the announcement of the resumption of face-to-face learning through the EO obviously has got a lot of people concerned. So I guess we'll just start there. How would you address those concerns?
Well, first of all, thanks, Chris and Sabrina, for having me on again. It looks like these maybe once a week meetings might not be enough.
I know, I'm sorry. I feel bad. I'm like, it seems like every day I'm like, can you come on tomorrow? Can you come on tomorrow?
Well, no, I think, things are changing, fast and quickly in this environment. Yeah. And, a pretty significant decision yesterday, the executive order the governor issued to resume in-person learning. And again, we recognize how these decisions aren't very easy to make. But ultimately, what we need to be able to express to our community is, why and how we plan to go about keeping kids safe in schools. And so that's going to be our continued focus and effort, going forward. We did meet with the governor several times, maybe 2 or 3 times since the shutdown of schools, to talk a little bit about, obviously she really wants to see schools return, and so do we. I think we all want kids back in school. And I think trying to find a way to do that is really, what this is all about. However, we know that in the community, there's of course a general concern because if you look at where we were, 2-3 weeks ago compared to where we are today, it looks like the situation has gotten worse and not better at this point. What is good to know, and I think public health and the governor's folks, if they could just really spend some time kind of talking about the pediatric, information that's out there, I think that would help, because I know that's our concern. It's not, we look at the numbers overall, the big numbers of cases that have affected Guam since the beginning of the pandemic, the number of hospitalizations and so forth. When it comes to the pre-K to 12 school system, what we want to know is, tell us about students, tell us about young people. Is the COVID variant having a different type of impact on our kids? Is that impact severe? Are we requiring hospitalization of any kids? Have required that type of support because of COVID. And it appears, at least in our conversations, that information that she does have, shows that the impact on children is much less severe than it is for the older age groups. That kids may be getting, infected with COVID, but they are not, either they're asymptomatic or they're showing milder symptoms, and it's not requiring, them to be hospitalized or worse. And that type of information, and as much of that information as possible, we've encouraged our partners at public health to please, help explain that to the community, because no matter what I do, I'm just the guy running schools. I'm not a health expert, and I don't have a medical degree. And they want to know from our healthcare providers and our doctors and so forth, what's really happening. So that's something that we just really have to continue to push with our partners to do, because that's really what the question is on the minds of all of our parents. Are our kids at risk, and what are they at risk for if they return to school? When it comes to opening, what we rely on, of course, are all the things that we can do to control the environment. And that means that, we follow, the requirements of public health. We follow the requirements of CDC, and we try to follow all of them. We don't pick and choose and say, hey, you know what, we'll do the hand washing, but no mask, or the mask, but no. We say, let's just do all the things that we can, because again, our strategy is to is to provide multiple layers of safety so that we can reduce the risk of transmission at our school sites. We do have, in addition to all those measures, the vaccination requirement. The vaccination requirement is on our employees. And so, we're nearing the 24th, which is the deadline for employees to be fully vaccinated. And those that aren't are going to have to submit to weekly testing as part of their employment. So that's going to be in place with regard to all the adults on campus. And of course, for the kids 12 and above, and those are primarily middle school and high school students, there's a general comfort level out there just because the vaccines are available. I think parents, they understand that there are always going to be risks, but the fact that the vaccination is available is really, I think one positive aspect that they can rely on. So really, I think the elementary school students are where the question, really is, the questions are coming from our parents. We understand that if you're 12 and above, you can get the vaccine, but, we don't have a vaccine for our kids. So how do we, go about keeping kids safe? And again, within the school system, that comes down to hand washing, your masking, your distancing, and so forth. And that's what we will continue to do. And like I said, today, we have not seen in our 2.5 weeks of opening, none of the transmission of the virus was happening on campus. But even after we shut down, we saw the numbers rising in the community. So, it's going to be a continued challenge overall to turn COVID-19 back in the right direction. But we're going to do our part. I think the only thing that I would say is that the governor's executive order, did a couple of things. One is it reauthorized opening of schools. And so, it left the schools or the school districts to determine what date we were going to open. And so I just want to, we will have an official press release with more detail, but I do want families to know that for the next week, we are going to continue with online learning until next Friday. Starting on the 27th, the plan is to restart in-person learning for all of our schools, and we are going to be doing that on a cohort basis, where we basically allow half the students to come to school on alternating days as a way to reduce the population on campus and allow us an opportunity to safely return. And then, after a couple of weeks, revisit, the cohorts and see what's happened at the schools to determine when we can resume full 5-day instruction on campus. So again, next week, we'll continue with online learning. And then the following week, we will begin in-person learning in cohorts. And then, we will announce further details in our press release and as we go forward. So that's our approach. I mean, I think the one thing we can't ignore is that we still are, as a community, in a high risk, situation by any definition. So we did want to take the week to communicate with our stakeholders, make sure they understood what was happening, let them know that these are the cohorts that are going to be assigned, and to just prepare them and not really rush to try to flip this over in a weekend for all 28,000 students in our system. So somebody asked us, well, why is it that you're going to take another week? I said to plan. Why isn't your plan ready to go? Well, that is the plan. The plan is not to have families day by day figure out what they're going to do. If we have to change the mode of learning, we're going to do so in a planned and orderly way. And we want to have the opportunity to let people know what's happening, because we're not a small organization, and it does take that time to make sure we answer questions, guide our stakeholders, and allow them to know what's going on so that they can plan accordingly. So I'll go ahead and stop there. And again, more details will be released later today.
John, you mentioned that we're in a high risk status right now. And I know that when you had come on and talked about the reopening of schools, was there ever a plan or mode that you guys would go into in the event that we did have to go to school in this type of environment? Because I want to say when you came on, you had talked about the certain triggers and high risk, and when we did reach the high risk status, I just wasn't sure what the posture would be. Would it be just like go home and bunker down, or what? Because it kind of looks like they're forcing your hand into going back to face while it's still raging out there.
Well, I think it really is key to really, again, continue to work together with public health and the governor to determine, who's going to take action when we reach a certain stage. Our plan at the beginning of the school year was to reopen because we were in a low to moderate risk environment, and that made sense to go ahead and assume in-person instruction. We had plans for how we were going to address the school-based, situation. So as we started to track cases, the question at that point was, well, when does the risk grow at the school level so that you would consider, closing, shutting down a classroom, shutting down a grade level, shutting down the school. So we really thought that with the resurgence of the virus, that what we would be doing would be, doing it on a school by school basis. Some schools have more incidents than others. Let's take a look and let's assess the risk of transmission at the schools. And then when we took action, it would be based on the data from every school, and it would be focused on individual schools that needed that additional intervention. So that's what we were planning, and that's what we were tracking, in the schools over that first 2.5 weeks. Now, the overall community risk environment, that does have an impact. It's not within our control, but we were monitoring that. And as you know, before the governor's decision, we were meeting with our constituents to really kind of flesh out, the comfort level in moving from full in-person instruction to things like cohorts, right? So we were considering that as the immediate step down from full 5 days of instruction. And again, because we realized that this situation may ebb and flow throughout the year, we didn't want to be operating between fully open or fully closed. We wanted some opportunities to continue with in-person instruction, but maybe do so in a different way. So I think, again, when the situation gets so bad in the community, I understand when the governor is going to make that call, and that's okay. But it looks like she's returning some of that judgment and responsibility to the schools. And so we are working to refine the approach for the rest of the year. And like I said, I think on Wednesday, looking at a risk-based approach to the rest of the year. What happens if we have another surge? What happens if we go back to normal, to a low-risk situation? Have the ability to adjust accordingly throughout the year without having to go into a full shutdown.
I'm wondering, can you kind of explain the part in the executive order regarding a testing plan?
Yes, so that's a kind of a hot topic right now because I think the governor and she's right. I think if she's following CDC guidance, the requirement for a screening testing plan is one of the key proactive ways of detecting COVID-19 on campus. So as you know, people may be asymptomatic but still positive. By doing a screening testing on a regular basis, whether it's weekly or every other week, it's an opportunity to just sample, sample test, your population, and be able to see if there's any need to address positives on campus. So the challenge is, I think those recommendations and those parameters really need to be set, by our public health experts, because I've done my own research into screening and testing, and there needs to be we need to determine what the right test is. Hopefully it's a rapid test if we can, but what's the right test? Who do we need to test? How frequently, and so forth. The CDC guidance out there basically says that if you're going to do screening and testing, that you really just need to focus on the unvaccinated people on campus, whether it's your students or your employees or the student athletes, because in sports, in order for the sports season to go on, they do recommend regular testing. So, we presented that as our basis of understanding what screening and testing is. But public health really has to really come up with its recommendations, because we also need to find a way to operationalize this in a way that makes sense. So I think somebody mentioned, just random test 10% of the population. I think the governor mentioned that, and we have to take a look and say, well, how do we do that? 2,800 students, something like that. How do you even operationalize something like that? And how frequent will that be? Is that weekly? Is it quarterly? So, that's something we need to sort out. She gave us a deadline on October 1st, and yesterday I told her that if that's the case, public health has to set up some parameters where you might have, all these different schools coming up with a variety of testing plans that may or may not be useful, when it comes down to it. So that's different from diagnostic testing. So the diagnostic testing is, when someone presents symptoms, so someone comes in, they go, I'm sick, I feel sick, I have all these symptoms, and you say, okay, well, here's the rapid test to see if those symptoms might be COVID-19, and that's the diagnostic test. The screening testing is really, for those who are not showing any symptoms, and it really is saying, let's get ahead of the game. If somebody is asymptomatic, we still want to know if they're on campus, if they're positive, so that we can monitor, the situation, throughout the year.
Yeah, I'm still kind of not clear on the whole testing plan thing, because it says that schools have to submit the testing plan included in their, I guess, reopening plans to public health, right, by October 1st. So he's saying that
Right.
Public health has to provide more information before you can actually come up with the testing plan?
Yeah, so a lot of us, private charter and public schools have all submitted, I believe, our reopening plans. I think the thing that was holding us up was just trying to finalize the bus transportation plan, because of course DPW has to be a part of that. So I believe that's been taken care of. So in the past week and a half, I think that the testing discussion has become more prevalent. I think she would like to see a testing plan put in place. And so she did have that discussion with us, and I think we just kind of pushed back and said, Governor, we need public health to set those parameters, because there are different ways to test. You can do random testing, you can do pooled testing, where you take a bunch of results from a bunch of people and then combine their results, and then test those results with a diagnostic test. There's serial testing, where you don't randomly test, you test the same people over a period of time. And gosh, this is just my Google University research. So I'm sure public health is going to have more, information at their fingertips to be able to say, what's the right type of testing? What makes sense for our community, so that, we don't have to do our guesswork to figure out what it's going to take to provide an adequate and sufficient, testing plan that'll give public health the information it needs to monitor what's happening in schools. So I think the schools are required to submit it, but without public health expertise, I think you're going to end up with a lot of different plans. In fact, some of the private schools are saying we don't really want to test on campus,
right,
and some of our community doesn't want to get tested. So what do we do then, right? So a lot to sort out before October 1st.
Wow.
Right. And so, do you guys even have test kits? Is that, or every nurse is trained to do these tests? And the nurses, I thought they were deployed to public health. Are they going to be back
Right.
at DOE
So
campuses?
there apparently there is a supply of the Abbott Binax Now tests. And of course, my understanding from the discussions is that there is now a shortage, or there's going to be a need to shift from that to another type of rapid test, because the company that was producing it actually just disbanded after the pandemic, thinking that there wouldn't be a need for any more testing. So we are, again, we're going to start with that, and they have available supply. They also have a $5 million grant from, I believe, from CDC to support school-based testing. So the resources are there, and that's helpful. So I think that's one issue that's hopefully taken care of. The training that's taking place is public health has supported us in training of employees. So we did one yesterday, and we will do one today. So that includes our school nurses and also other people on campus who are already CPR trained and so forth. So we should have enough people on our campuses trained to conduct the tests if needed, especially if it's the Abbott Binax Now test, which is what we're using for the training. So again, we have the capacity, we have the, seems like we have the resources. The question is, what is the plan? Like, who's going to get tested on what frequency? At what frequency do we require consent? How do we obtain that consent? And all sorts of questions.
Yeah, because
Like,
I'm
you
not
just
sure
can't
I'm
go and say,
comfortable if.
you can't just go on campus and say, let me just,
Shove
test the
a-
volunteers or test, my friends that I can get them to volunteer because nobody else wants to do it, right? You're going to get results that may not be useful to you. So, how do we conduct this testing and under what authority and so forth? So, yeah, we can figure out some of it. We just can't figure out all of it.
Yeah, this testing strategy, are we talking about children or are we talking about staff?
We're talking about both.
Yeah.
Oh,
Now, remember, the employees will already kind of be taken care of if we're talking about testing the ones who require weekly testing because they opted not to take the vaccination. Right. So there is already a group that's going to require testing. So I'm trying to factor them in. And then there's an indication that especially when you're in a higher risk situation, that students need to be tested as part of that sampling.
Yeah.
Let me clarify for the student athletes out there and the families out there interested in the interscholastics. The executive order also authorized the resumption of practice and competition for interscholastic sports. So both our middle school and our high school sports will be moving forward. So we'll provide more information on that. Again, not before the 27th, but once we get to the 27th, that should also be moving forward. The order requires every coach and also every student athlete above the age of 16 or 16 and above either show proof of vaccination or submit to weekly testing. So that is different from before, and I think in line with the organized sports that are currently authorized. So that's something we'll have to let our folks know, our students and our coaches know of these new requirements so that they can also comply.
what about the part in the executive order regarding spectators shall be allowed at interscholastic sporting events and competitions subject to applicable public health guidance? What exactly is the applicable public health guidance?
Yeah, we'll have to go revisit what the latest guidance was. I know that we had a number of different memos that were done early, last year when we did interscholastic. So I recall like at the end of the season, we might have been talking about 50 spectators indoors per team, something to that effect. But I'd have to go back and just double check what the last memo was. But I assume that if we resume sports and the spectator rules would revert to the latest DP public health guidance memo. So it's either from last year or they're planning to update it. So we'll leave those details to public health, and then we'll let our families know.
All right, John. Anything else you think parents should know?
Well, I do want to just share with them that we had a board discussion and a work session yesterday. I think across the board, I think they all have concerns about the general health of the community. And so that's not taken lightly. I think they all want to see the kids get back to school safely at some point. So we did have a discussion about the timing and how we were going to go about with cohorts. And I think it's kind of right now we feel that that's a good approach based on everything we've heard from our constituents and our stakeholders. But again, we'll continue to listen and continue to monitor the situation so that we can provide continued assurance to our parents that kids are safe. So it's not an easy thing to do, but we recognize, we acknowledge that there will continue to be anxiety and fear and concern in the community. We believe that we can bring our kids back safely in the way that we've proposed, and we're going to continue to be vigilant and keeping watch over our kids to make sure that we do what we need to do to meet that responsibility.
I'm sorry, I did just have one more question regarding that testing plan as you guys stand it up, but it was mentioned in the executive order that testing strategies to identify and isolate positive cases on school campuses. So does each school have like an isolation room, isolation area?
Yes, every school does have. I mean, so we usually have a nursing office, but we've also have an additional isolation room for those kids who are symptomatic. And so you come in and present symptoms like COVID-19, the nurse will make that determination. The kids will be in that isolation room pending pickup from their parents. So that's usually how it works. Now, when we're talking again about screening testing, is that these may be for asymptomatic individuals, right? So we may find positives where they're not showing any symptoms. So that's something that, again, we need to think through. What happens if we get that result, right? And so we'll need to make sure that protocol is in place. I don't know if they're considering pooled testing, but pooled testing is where you basically take the samples from a bunch of, from a sampling of your population, could be one school, take the samples, and then you combine those results, and then you do a diagnostic test to see if there's any positive in your population. If you do it that way, you won't know exactly who it is, that's positive. You'll be able to detect whether it's, so I don't know, again, like I said, those are different ways to do it. We need to know what public health will find useful in helping to give guidance and, about how we keep our kids safe in school. So that's why I keep stressing that partnership and with the governor. It's not something that we should create on our own if we're going to do this right.
Amen, John. Thank you for your time this morning, John.
Thanks, John.
All right, thanks. I appreciate it.
We appreciate it more. It's 8:05. Let's go ahead and jump over to KUAM TV right now. Good morning. Good morning, Guam. It's Friday business. Good morning, KUAM TV. Welcome to the link.